So we're here to show you how to do PNF stretching for the hamstring. So we're going to use the method called contract and relax. So I'm going to instruct my patient Laura, if you please lay down or lay back for me. Okay, so what you're going to do is you're going to instruct the patient, or you help the patient passively come up into a stretch. So here you're going to ask them to let you know when you feel a stretch. Okay, and you're going to hold that for about 6 to 10 seconds. Okay, while you're doing this, you're watching the athlete or your patient, make sure that there's no pain or discomfort. And then I personally give them a little bit of a tap and give them the cue, go ahead and push all the way to the floor or all the way to the ground. Push, 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 push. And as soon as your hand hits, you're gonna come back up and you're gonna hold this stretch for about 30 seconds. And you're gonna repeat that 3 to 4 times.
Okay, so this is another PNF technique called hold relax. This is to help our quads, since we're trying to work on flexibility of the knee. This is a great one to perform to alleviate the tight muscles, the tight quads here. So I'm going to bring my patient back this way, stabilizing the hip. I'm going to bring him back till I feel a stretch.
Okay, right there.
Okay, right there. Okay, so we'll hold it for about 10 seconds. And then I'm going to say contract. And he's going to push against my arm with his leg. So trying to get that knee extension for 6 seconds. And then relax. And then we pull him into a little bit further stretch for 30 seconds.
Okay, so this next exercise for flexibility is going to be called the 5-way lunge. So what you're going to do is instruct your patient, you're going to go into 5 different positions. You're first going to lunge forward. You come back to neutral, so your patient will stand with your feet together. You're going to go out to a 45-degree angle, out to a 90-degree, back to a 45, and then straight back. That's going to work on different motions of the hip, along with some of the hip flexors and also the knee. My patient to keep your feet kind of together, a little bit apart. We're going to primarily focus on the right leg. So what I'm going to have her do is step forward into a lunge with her right leg. She's going to come down, and then she's going to come out to a 45-degree angle. Do one, okay, and then go straight out to the side. Back, and then here we're going to have her step forward a little bit. And this one's a little bit different. It's going to be back to a 45. Back together, and then straight back.
Oops.
So there we have the different ways. We can actually adjust this, so if we want more of a stretch, we instruct our athlete to hold it in ways. So Laura, what I want you to do is go ahead and step forward and hold it for 15 seconds or so. This one's going to be a little bit harder for some athletes because it requires more of a core stabilization, and then also it requires balance. So go ahead and go back to neutral, and let's just do one at 45 degrees. So this not only works on the knee, but also on the hip, because on the contralateral side, it will help stretch that hip flexor.